Welcome to the overview of the Boston Assessment of TBI Lifetime, 2nd edition. The Boston Assessment of TBI Lifetime, or BATTLE, was initially validated in 2014 against the Ohio State University Traumatic Brain Injury Identification Method. Since 2014, the BATTLE has been used in over 100 research studies within and outside of the VA, and has been implemented in clinical and research settings worldwide. 15 years after developing the original BATTLE semi-structured interview, we have updated the instrument in several critical ways. At its core, the BATTLE is a forensic semi-structured interview that guides a clinician or researcher through a series of prompts to understand the events prior to, during, and after suspected head injuries.
The second edition of the Boston Assessment of TBI Lifetime has been a long time coming and has major updates from the original measure. The biggest change comes in modernizing how the BATTLE 2 classifies TBI. In the last 6 months into 2024, there have been two big updates to how traumatic brain injury field characterizes TBI. First is the American Congress of Rehabilitation Medicine's, or ACRM, new diagnostic criteria for mild traumatic brain injury. These new criteria integrate multiple criteria by which a mild traumatic brain injury can now be classified.
Second is the National Institute of Neurological Disorders and Stroke, or NINDS, and their TBI classification and nomenclature workshop, which occurred in January of 2024. At this workshop, they presented the new clinical biomarker, imaging, and modifiers framework for classification and characterization of traumatic brain injury. The new BATTLE 2 integrates both of these models into a new classification and characterization system.
Here we see that the BATTLE 2 integrates these updates in the field with this new classification system flowchart, including 3 potential pathways to diagnose TBI. All pathways require the clinician to first determine whether or not a plausible mechanism of injury has happened. The first pathway, as you can see here in the dark blue, shows the clinical signs pathway using the traditional LOC, PTA, and AMS at the time of injury to diagnose TBI. Next, the clinician determines if there are other confounding factors that would better account for these symptoms. Finally, the clinician confirms the TBI or determines that no TBI is present. This first pathway remains the same as BATTLE 1. The second pathway in the lighter blue and highlighted in yellow here uses acute symptoms plus clinical examinations and/or laboratory findings to classify TBI. In the retrospective TBI assessment setting, this means that medical exams taken at the time of injury and/or laboratory findings following the injury can now be considered when classifying TBI. The third pathway, also in the lighter blue and highlighted in yellow, adds neuroimaging abnormalities as a possible way to classify TBI.
The BATTLE 2 classification system flowchart also adds 2 diagnostic categories. First is suspected TBIs for injuries that do not meet criteria on the 3 pathways above, but are still meaningful to capture. This makes the BATTLE more comprehensive in its ability to capture injuries across the wide spectrum of head injuries. The second new diagnostic category is confirmed TBI ungraded and is used to categorize TBIs confirmed via non-clinical signs pathways. We have found that this is the least common diagnostic category, as it requires either neuroimaging or laboratory findings at the time of the injury, but we suspect it will become more common as these tools are integrated into the clinic. When administering the battle, after the clinician gathers all of the information from a TBI, it is recorded using the TBI diagnostic characterization table here. This makes the Battle 2 innovative for two reasons. First, it maintains backwards compatibility with TBI diagnoses using the mild, moderate, severe grading framework, as you can see at the bottom. Second, it is forward compatible with new developments in TBI characterization, such as new biomarker or imaging standards, and can be seen here in the way that it integrates the CBIM framework directly into the characterization table.
One of the main limitations of the first battle was time burden. Now, as you can see here, users can select specific context-specific modules can be chosen a la carte to best fit their research or clinical goals. For example, choosing to only use the sports TBI, IPV, or military blast module, thus reducing time burden significantly. Additionally, Battle 2 now offers modules to account for subconcussive injuries in populations that are at high risk for multiple blows to the head, for example, IPV, or specific military duties that require the use of large artillery. Some of the highlights of this second edition of the battle include the fact that it's been developed after 15 years of research showing that Battle 1 is a valid and reliable assessment of TBI. Battle 2 is designed to assess exposures to blasts, TBI, subconcussive occupational exposures to blast overpressure, and subconcussive blunt hits. It also has a reduced assessment duration with a flexible battery approach and simplified administration process.
The Battle 2 is adaptable to high-risk TBI contexts in clinical and research settings, including military, sports, civilian, and IPV. The Battle 2 is consistent with previous TBI diagnostic standards while reflecting updated standards in TBI classification and characterization as laid out by the ACRM and NINDS. For more information about the Battle 2, or if you would like to be trained in its implementation and administration in your research or clinical setting, please go to our website where you will find a form to request a full training of the Battle 2 and become certified in its administration. Thank you.